Hello everyone, my name is Sahira Abreu. I'm a student physical therapist assistant and I will be talking to you about benign paroxysmal positional vertigo. Before I talk to you about my peer review on vertigo, I want to give you a brief summary of what exactly is vertigo. Vertigo is the movement of autoleads disengage and enter one or more semicircular canals. Autoleads are calcium particles that clump up in the canals of the inner ear, in turn causing a disruption of messages being sent from the ear to the brain in terms of proprioception. Causes of vertigo can be due to various head positions, Meniere's disease, which is the buildup of fluid and changing pressure in the ear, or labyrinthitis, which is the inflammation in the ear. This can become a serious condition if vertigo compromises the individual's balance and a fall occurs. So here's a picture of the inside of the ear. I just wanted to show you exactly what is going on when vertigo occurs. If you take a look at the name utricle, utricle is the area of where these calcium deposits are usually held. When these calcium deposits are broken off, it can occur in either one or more semicircular canals. It is more common to occur in a single semicircular canal, whereas 6.8% to 20% report to having it in multiple canals. When we're dealing with patients with vertigo, symptoms they could be experiencing, just to name a few, are vomiting, loss of balance, and especially the sensation of spinning. Diagnosis and treatment. Patients with vertigo are often diagnosed using the Dick-Hallpike maneuver. After being diagnosed, the patient is eventually treated by the physical therapist using the Epley maneuver. Both procedures are usually done by a physical therapist specializing in vertigo. Since we have a background of what is vertigo, I'm going to continue on with my peer review. The peer review I investigated is called the benign paroxysmal positional vertigo with simultaneous involvement of multiple semicircular canals. This study was taking place at a Disney clinic where examiners wanted to investigate the clinical characteristics of multiple canal vertigo in comparison to the single canal vertigo in the patients that came to their clinic. According to the methods section of this study, there was 1,054 patients diagnosed with vertigo. There was only 874 patients that were included. 52 were lost due to follow-up, and 128 was described as to watchful waiting. To be considered a successful treatment, they defined it as the resolution of a typical nystagmus and positional test, along with the resolution of positional vertigo. The software they use is called SPSS, which is the software used for data collection. Subjects. There was 270 males, 784 females. The patients ranged between the ages of 11 and 89 years old. There was 1,005 patients that were diagnosed with single canal vertigo, and only 49 patients that were diagnosed with multiple canal vertigo. In determining single versus multiple canal vertigo, the Hallpike maneuver was used to provoke symptoms of vertigo. Patients with a duration of 60 seconds or less of nystagmus and vertigo symptoms were in Group A for the single canal vertigo. Group B was multiple canal vertigo, where they experienced a severe nystagmus and longer duration of vertigo symptoms. Here's a snapshot of Group A single canal vertigo. The average age was about 54 years old. The gender ratio was male to female at 257 and 748. The amount of days of vertigo was about 5 days, and the amount of clinic visits was 2 days. In Group B, the average age was about 54 years old. There was about 13 males and 36 females. The duration of vertigo in days was about 7, which is a little bit longer compared to Group A, and the amount of clinic visits was about 1.7 days. The results. First and foremost, the mean age did not differ amongst groups, nor did the gender. The multiple canal vertigo patients basically had an underlying condition such as head trauma, Meniere's disease, labyrinthitis, or otis media. Incidence of labyrinthitis in particular was significantly greater in patients with multiple canal vertigo compared to patients with single canal vertigo, meaning that these underlying conditions can be the reason why these patients have multiple canal vertigo versus the single. Next, the finding also determined that Group 1 demonstrated a significantly shorter treatment at 3.8 days versus the duration compared to Group 2 at 11.9 days. Here is a chart that is broken up into different kinds of conditions and also single versus multiple canal vertigo. As you can see, there is significantly more conditions in multiple canal vertigo than single canal vertigo. With the continuation of results, since Group 2 had a longer duration of vertigo symptoms, Group 2 also received more treatment procedures than Group 1. To wrap things up, age and gender did not have any correlation, nor did it show any major influence in the study. They found that single canal vertigo is more common and easier to treat, whereas multiple canal vertigo has been reported more likely to be accompanied by an underlying condition. Limitations for the study. There was a lot of pros and very few cons. One con I will consider is that the study sample came from a community base. It was not on a global standard, but the pros outweighed the cons. They had a good mix of females and males, a wide age range, and a large sample size. Relating vertigo back to physical therapy. It is important for us to understand that patients with vertigo are experiencing a world that is spinning. The symptoms are uncomfortable and can be dangerous. As far as exercises, they are not the same as someone with a knee replacement, but requires a lot of patience, gazing exercises, and balance training. To give that patient the best treatment, we should refer them to a physical therapist who specializes in vertigo. This will give them the optimal benefit in getting the correct diagnosis and treatment. So that concludes everything. Thank you for listening. If you have any questions, please comment in the comment box below. Thank you. Have a good day.